I have been chairing a very special session under the Congress that it's a panel discussion on disparities in hematology care, lessons learned from Ukraine. Lymphoma Coalition has been pretty active since the conflict started. Mainly, we were at the beginning trying to understand the needs. We got in touch directly with the Hematology Association, the Ukrainian Hematology Association, to get to know how the conflict was disrupting lymphoma care, but we discovered that we needed to go beyond lymphoma care to try to help as much as possible. We were first thinking about matching patients with hospitals abroad because we were asked to help them to bring patients abroad because they couldn't continue offering care treatments. It was also because of not only the disruptions properly for what was happening, but also because medicine shortages and even human resources shortages because of the displacements of people. But we gradually learned that Ukraine, for instance, there is huge variability in access to care. For instance, all the bone marrow transplantation units are in Kiev. All the PTC scan opportunities are in Kiev as well. So when we talk about disparities in Europe, we normally think among the countries, but there are a lot of disparities also across the same country. What we are trying to do now is to learn how to improve access from diagnosis, from detecting symptoms earlier, access to treatment, but also access to care in general, including all the dimensions of care. We learned also that for the major organizations that have a role on public health, cancer is not the biggest of the problems because they are non-communicable diseases. That means that all the stakeholders working in hematology need to be prepared to jump in when any conflict like this may happen, but we don't need that really because the disparities were there before. And together with IHA and other stakeholders, we are mapping those disparities, how we could be getting standards that could be guiding how to structure better hematology care across Europe, how to help to bring to the next level countries or hematology units that are not well equipped. It's about the rate of clinicians or nurses per patients they need to treat. It's about the way you address also even research. When research is planned, a lot of minorities are not included, so they are not well represented. So when you have those treatments and need to make decision making on treatment, you cannot really base your decisions on evidence. We have also seen that by bringing patients abroad, we can provide access to other medicines that were not even trained in Ukraine. However, what if the patient comes back? What if they decide they want to come back and it's a treatment that do not have a fixed duration? For instance, it's a treatment intended to take longer. We do not have evidence on how to manage those cases, so probably you would, even having better treatments available, you would need to continue offering those that are toxic, those that are has less efficacy. And beyond that, we are receiving reports very curious. For instance, in Ukraine, doctors dedicate longer time to talk to the patients. So they compensate all the things by talking with the patient, which is important also for the patient experience because one thing is the quality given and another thing is the quality perceived. So their perception when you invest time with your patient is that you are dedicated to him or you are getting to know more about how they feel. However, in the Western countries, sadly, doctors are always in a rush and they cannot do that. They can just spend like 5 minutes per patient. You have very young people, the fellows, of course, doing the residency, and they also come to visit the patient. So depending on the cultural settings and the previous experiences, they may not trust as much, or they may think that they are not provided the best care possible. Beyond that, we are trying also to understand the supply chains, because that also has an impact on disparities. If you do not have capacity, not only to bring medicines, for instance, or diagnostic tools, but you cannot then distribute those, you won't be solving the issues.